Exactly.
Shifting gears here, I want to highlight the updates that we are getting on the coronavirus front, since that is the wild card really in terms of what we'll see come through here. And on that front, a bit of a good news, bad news situation in terms of one of those states we've been watching here with Florida, reporting a drop in daily hospitalizations down to 268. That was down from 334 previously reported. Well, the positivity rate on their daily testing came up to 11.4% versus 11.1%, so a slight tick higher. So what does that mean in terms of where that state's going? Perhaps it's going the right way. For more on that, I want to bring on Dr. Dori Russ, Medical Director of the Russ Group out in Florida. And Dr. Russ, I mean, when we look at this, how should we be thinking about that good news, bad news situation? Because nationally, Florida obviously had played a large part in the spike that we saw higher. It's coming down a bit now. So what are you seeing on the ground there?
Well, just like we say in elections, so goes Florida, so goes the nation. So we're definitely going to want to keep track of these numbers. We are aware that there's a delay between testing and actually having those numbers come. But when we look and see that the hospitalization rate's going down, that's reassuring. At the end of the day, COVID is going to be around until we either have a vaccine or a cure. So if we can manage to, again, flatten the curve and keep people out of the hospitals or make sure that we have beds for those people that are acutely ill, then we'll be doing better. But yes, the number of patients that are testing positive are definitely going up, partially because we have expanded access into testing, but also because we see that positivity rate going up as well.
Yeah, and to your point on whether or not we've turned a corner, or whether there will be more corners to turn here when we think about what's happening in China. That's another hotspot we're watching there after they notched the highest amount of coronavirus infections in more than 4 months, with new outbreaks currently going on, trying to get a handle on that. But as you said, until there is a vaccine, clearly, perhaps a lot of these efforts here to put fires out as we get them. On the vaccine front, though, we did get the update from Moderna. The CEO joined Yahoo Finance earlier today off the news that it was getting an additional $472 million award from the Biomedical Advanced Research and Development Authority. And he gave the update. I want to get your thoughts on what he had to say here, because it sounded like he could get to an efficacy point of October, or by October or November. Just want to play what he had to say on why the company might still need to charge and the need to make this vaccine out there at a cost that will be profitable for the company. Here's what he had to say.
We have said before, we have to make a profit out of the first product we sold, because we have invested $2 billion of our shareholder capital since we started the company. The company has never made a profit. And as I said, we raised another $1.3 billion of equity capital in May that is going to make product at risk, assuming the product is successful. And so we need to get a return. We are highly aware that this is a pandemic and that we need to be very, very responsible how we price the product. We've said before, we will price the product within the range of vaccines already approved.
Thanks there, Dr. Russ. I mean, when we think about it, October or November would be a pretty optimistic timeline in terms of getting a vaccine out here to the people. But also on the profitability front and what price this might come through. I mean, how important is that when we think about what this vaccine is really trying to do in building up immunity among a population, and why it's going to be important to make this affordable?
Absolutely. So talking about the timeline, October, November, that's when we're going to be entering into flu season. So we definitely want to be able to, if possible, immunize people so that we're not having two competing interests. Is this the flu? Is this COVID, and having people back on the ventilators and in the hospital? So the timeline would be ideal. Again, anytime you talk about clinical trials, that is the speed of lightning for what a typical clinical trial is. So we do have to acknowledge that. In terms of the price point, while we'd always like to think about we should be able to give health care and it should be a given for all, we do have to realize that no money, no mission. Again, I know that there are going to be hopefully different nonprofits that are going to be assisting and helping patients get that, but we do have to be reasonable and realize that if they can't get the vaccine, we're still going to be in the same position we are. So again, no money, no mission. And I definitely want the company to be profitable, but I also want to make sure that we can get it to patients.
Yeah, and right now, just this morning, we got the update that the first of those patients in that trial, about 30,000, had been dosed in that trial there. And Dr. Fauci has given it a lot of credit in saying that it's moving along in the right direction. So we'll see what happens on that front. But in terms of what we're seeing play out in the case counts, and we're going to get in a little bit more into detail later on in the show and digging out hot spots, even beyond the ones that we're seeing, especially in Florida. But one question I want to pose to you about where we're seeing these case counts come from was kind of, I guess, personified here in Larry Kudlow giving the update to the press today. that National Security Advisor Robert O'Brien contracted coronavirus, likely through coming into contact with it through his daughter. And I distinctly remember when this all started, Dr. Deborah Birx coming out and saying, look, it's going to be up to younger Americans to really control the spread of this virus. And we've seen a lot more younger Americans get out there and start traveling because, as we know, the health risks to them are not necessarily the same as older populations. So in your mind, is that really what's going on here? Have you seen maybe younger Americans take their foot off the gas pedal and maybe controlling the spread of all this?
Well, remember, I'm in the spring break capital of the world. So I've seen two things. One, we have younger people that, again, if they do get sick, it's a loss of taste or smell for most of them, and they're back and feeling back to normal in a few days. They definitely are giving it to either their parents or grandparents, which we're trying to do public health campaigns. We're trying to make sure people are aware of the risk. And then the other thing is, again, I'm in Florida and we are still having a lot of communal gatherings, whether that be a barbecue, whether that be a revival, a church service. We're still seeing a lot of people get together in those groups larger than 10. So again, it's a lot of public awareness. It's a lot of messaging, but at the end of the day, it's behavior. And behavior is one of the hardest things to change, whether it be an infectious disease or a chronic disease. It's one of those things where we actually have to get to the root cause.
Yeah, and when we talk about that, that obviously is at the core of what's coming here as we approach the fall school season, and a lot of question marks around how you can actually social distance in some of these classrooms. And that seems to be a push and pull argument here in your community here among doctors and experts saying, look, it's going to be a very tricky thing to get schools back up and running here if we do know that some younger Americans here can be vectors to bring it to more susceptible populations. So what's your take on what we should be thinking about in actually doing this in a healthy and effective way?
Absolutely. So as a physician and a mom, this has got to be one of the biggest challenges of my career and personal life. I don't think there is a good answer for what we do for the schools. We know there's the risk. Virtual learning would be ideal until we're able to get the numbers down. I know that's not feasible for some families. I know that's not feasible for some students. So that becomes a challenge. But while we have to do that, if people are going to be in those classrooms, we have to make sure that they are 3 to 6 feet apart. The science says 6 feet. I know they've come back and revised it given the logistics and the actual space of classrooms. My son's supposed to be starting kindergarten. He's supposed to be on a rug for circle time, but he's going to be Zooming. So this is going to be a challenge for all of us. I'm imagining him Zooming for 7 hours. I don't know how that's going to go. I don't anticipate it'll be well. But I trust our teachers. I know educators can get our students to where they need to be once we have resumed some semblance of normalcy. But we have to make sure we're all safe and we make it to that point. So again, I know in Duval County, they're talking about masks and even face shields for some of the younger children, making sure that they're keeping the movement limited so that you're not having too many people be exposed to too many other people, and preparing for what happens if you do need to shut down schools or even the county. So they're preparing. It's the same things: frequent hand washing, hand masks, social distancing as much as possible, and being aware. Now, how you tell a 5 or 6 year old to social distance, I have not figured that out.